Good afternoon, everyone. Thank you so much for joining us today for the New Economy Network Australia's webinar, looking at the connections between health and wellbeing in the new economy. We are truly delighted to have three fantastic women speakers on our all-women panel, but I will not try to be too excited about that. My name is Michelle Maloney. I'm one of the co-founders and directors of the New Economy Network Australia, and I'm really delighted that you can join us for this important conversation. Firstly, though, I'd like to acknowledge country. I am really lucky that the view behind me in that beautiful picture is actually, if I walk out of my house and up about 600 metres and look out over the hills, I can see the Glasshouse Mountains. And these are absolutely spectacular landscape. And I would like to acknowledge that the traditional custodians of this country, and it's this whole area that I now live in, is a meeting place between the Gubbi Gubbi, Jinnaburra and Turrbal peoples. Depending on which particular patch you're on, there's different folks that you need to acknowledge. But I would like to acknowledge all of those groups, the remarkable civilizational culture of the first peoples of this place and the entire continent. It's become quite a Zoom tradition to write in the Zoom where you're from and whose country you're on, so please feel free to do that. I'd like to acknowledge the elders past and present, the young people who are coming up and caring for country and listening to their elders. And the work that we do inside NINA, we try to acknowledge our place and situate ourselves within this bigger picture. I'm a descendant of Irish convicts who were drawn here through the British Imperial Project. And whilst the horrors of colonisation continue through into the legacies of our legal system and injustices, I myself am so thrilled to be able to call myself an Aussie and to have been born in this gorgeous continent. But everything we do inside NINA and our other organisations, we work in solidarity with the Indigenous custodians of country and are in deep admiration of how they have cared for country and cared for each other since time immemorial. And speaking of caring for each other, what a wonderful topic today. I'm so excited. I'm looking forward to hearing about the important research and work that each of these terrific women are doing. The New Economy Network Australia was created very loosely in 2016, announced in 2017, and became an actual grown-up incorporated cooperative in 2019, 2020. NINA's mission is to help stimulate the kinds of conversations we must have in our society if we're to change our economic system and bring a very different system into play into Australia. We're made up of organisations and individuals who are committed to the sort of 5 core platforms, looking at social justice, caring for planet, caring for country, working in solidarity with Indigenous friends and colleagues, and looking across a range of other social and democratic justice issues. So if you're not familiar with NINA, please do look us up. I'd like to acknowledge also my colleague Sarah Bashforth is on this call with us, and we'll keep putting little website info and things in the chat. So before we start with our speakers, today will be run as follows. Each of our lovely folks will talk for about 15 minutes each. I will cheerfully interject by singing a song if they go over time. No, I promise I won't, but I will cheerfully interject. And then at the end, we'll open up for Q&A and discussion. So please, at any time, put your questions in the chat. Sarah and I will do our best to collect them. And as you know, sometimes you don't get through all the questions, but if you're kind and patient with us, we'll do our very best. So that's enough from me. What I would like to do now is make sure that I'm introducing folks in the order with which we are expecting. So first, our first speaker is Steph Kilpatrick from VicHealth, and she's going to look at building the foundation of a healthy community and some of their amazing project work at the moment. So we'll have Steph Kilpatrick first, then Min Seto, and then Carla Clarence. So I'll introduce each speaker as we go. And yeah, without further ado, over to you, Steph. Thank you so much.
So yes, thank you very much for inviting me today, and I would like to officially begin by also extending my acknowledgement of the land from which I'm joining today, which is the land of the Wurundjeri people of the Kulin Nations, and pay my respects to elders past, present and emerging, and extend that respect to any First Nations people who may have joined us today. And also acknowledge their long history and deep knowledge in wellbeing and care for country and how important that is in this work in this space. So yes, I'm Steph Kilpatrick. Currently I'm the Policy and Government Relations Manager at the Victorian Health Promotion Foundation, or VicHealth as we are known. And we have been doing a fair bit of work in the wellbeing economy and wellbeing governance space, but also in planning regulations. And so I'm really excited to be here today to talk about that synergy. So first of all, as the first speaker, I'm sure I'll just set a little bit of the scene in terms of what wellbeing economy and wellbeing governance means to VicHealth. And often when we talk about a wellbeing economy, or as sometimes a key focus on a wellbeing budget is often talked about, what we're talking about is aiming to move beyond the focus on gross domestic product and economic growth and economic indicators as our primary markers of progress, and shift towards indicators and a system of governance that prioritises health, social aspects in terms of people, and environmental outcomes. So really trying to shift that focus to planet and people, both the people that are living today, but also the generations of the future. So having that long-term view of well-being and not just focusing on short-term economic growth and outcomes. The idea of a wellbeing economy has really grown out of a number of movements, but in particular reflects an evolution from the sustainable development movement, but also the health in all policies movement. And in particular, that health in all policies is a really big connection for us at VicHealth and the work that we do, and the evolution into our role in this space, and as well as health in all policies and its impact and inspiration for looking at planning regulations. So why do we need a wellbeing economy or wellbeing governance system? Really, this evolution has been called for because there is firstly a lot of really clear evidence accumulating that despite previously seemingly strong economies and therefore strong countries being attributed to strong economies, we're really seeing economic growth at odds with the well-being of people and planet. And so, to put it bluntly, it doesn't matter how great your trade income is or how good your GDP is, if your country is on fire and your people can't pay their rent or afford to see a doctor despite being fully employed. So we really do need to have a shift in the way that governments are thinking and making decisions. And that's really what a wellbeing approach tries to do, is try to shift and create a rebalance approach to decision making. And it does this by pursuing solutions that have holistic benefits for individuals and communities. It does this by protecting our most marginalised people while also protecting the planet. Addressing challenges that often fall between government departments and trying to break down those silos, while still again taking into account the needs of people in the present without compromising the ability of future generations to meet their needs. And again, particularly on that last point, many of you will be able to see that evolution again from the sort of sustainable development movement. But the reality of a sort of wellbeing economy or wellbeing budget approach, it tends to be a focus on budgetary responses. It again tends to be this focus on economic indicators. And so for VicHealth, this is why we do now talk about wellbeing governance. And this is about not just stopping or focusing solely again on economic indicators and budget outcomes, but looking to completely transform the way that governance and governments work. And again, making sure we're not getting trapped back in a solely economic indicator frame. The budget is, of course, a hugely important mechanism, as is the economy as a whole, to setting the way that people experience well-being and our society and planet have experienced well-being. But as has been graphically illustrated, particularly in Victoria over the last few years and during the pandemic, the regulatory and legislative systems can have just as strong an impact on our day-to-day life. And this is really sort of where VicHealth has started to also look at the planning laws and the way that we build communities from the ground up, and the impact that that has as well. So for us, a successful intergenerational wellbeing approach transforms economic and political systems to serve a more holistic understanding of quality of life and collective wellbeing that benefits both people and planet. For us, such an approach should involve government having iterative and impactful community consultation. Yes, still having wellbeing budgets, but also being supported by frameworks, legislation, and impact assessments. And also having a centralised minister for wellbeing governance who can really be a champion for reform. And it's these particular two dot points in terms of frameworks and legislation and a champion that really looks to break down those government silos and break down the short-term thinking that we often see in government. This would ultimately help us deliver a healthy, thriving environment, see investment move upstream into prevention, both in terms of health prevention, but more broadly across the social determinants of health and wellbeing, and deliver healthy communities today and into the future. And I've got some website links there if you want to delve a bit more specifically into VicHealth's wellbeing governance work. But it is through this more holistic approach to government and governance that VicHealth has started to re-embark on its work into reform of our planning laws and regulations, which brings me to the more substantial part of my presentation today. So we all know that the way our cities, suburbs and towns are planned, designed and built plays an important role in determining our health and wellbeing. We know that when people have easy access to healthy food, to green spaces, to exercise and reset mentally, as well as being connected to services and shops through walking and bike paths, and just generally having services nearby in their community, they are more likely to enjoy good health. However, our communities are rarely designed with health in mind. And this means that people living in wealthier suburbs have been able to generate better healthy infrastructure, not just literally in terms of access to GPs and to hospitals, but in terms of those walking tracks and green spaces, being able to ensure that healthy food retailers are setting up in their community. And that means they are enjoying significantly better health outcomes. Meanwhile, harmful industries, and in particular unhealthy food retails and outlets, are more likely to prey on low-income communities. Fast food companies, for example, are more than twice as likely to locate their outlets in low-income suburbs with limited provisions in planning laws for local communities to try and stop them or push back from another outlet being set up in their community. These various issues combine, again, to often entrench disadvantage in our communities. And this is sadly illustrated in this poignant graphic called Lives on the Line, Life Expectancy at Birth and Child Poverty as a tube map, or a version of the London train map that shows life expectancy from station to station. And there is a 20-year difference in life expectancy between those born in an area called Oxford Circus, which is a very wealthy area, compared to those born on stations on the Docklands Light Railway line or a poorer area of London. 20-year life difference. And this isn't just the case for sort of our literal health infrastructure or healthy food retailers, but it's also true when it comes to key social determinants of health as well, including housing. For example, parking is the largest single land use in many American cities. There tends to be more square footage given to housing cars than housing people. Just going to say that again. There is more square footage for cars than for people. In America, half of the trips in cities are under 5 kilometres that people undertake, but almost all of those trips are taken by car because the cities are so unsafe in terms of walking, and public transport is so inaccessible for people that their only solution is to drive, despite a relatively short commute. Every jurisdiction in America has in their legislation and bylaws a minimum number of parking spots that are allocated for restaurants, for schools, for shopping centres, whereas on the flip side, in terms of housing, there is a maximum amount of people that you can put on a certain land space, which does often make sense. You obviously don't want, tiny square footage being allocated for people to live in. But at the same time, there's this real kind of strange dichotomy that has been created where, again, you're ending up with more square footage for cars than people. And I think it's a really great question in terms of the way that we design our cities is, should cars, should roads, should car storage be given this pedestal that is continuing to impact the way that we can prioritise land use and prioritise the space that we're giving to people and communities, as opposed to, this one particular mechanism of getting around. And this has flow-on effects to other parts of health. As we see suburbs spreading, that means longer travel times for work, that means increased sedentary time, both literally in terms of your commute, but then it also eats away into any time you have to engage in physical activity. It also means that as we see more car trips taking place, we see pollution increase in cities. And that, of course, also has its own impacts on health and well-being in terms of reducing the immediate cleanliness of the air we breathe, but also continuing to contribute to the climate crisis. Potentially, an electric vehicle transition partially helps these latter two issues, but it still doesn't necessarily address the way that we're creating our suburbs, creating our cities. It doesn't rebalance things in terms of housing, and continues to see sedentary time and physical activity, sedentary time increase and physical activity time decrease. Today, 55% of the world's population lives in cities. And by 2050, that number is expected to be 68% of the world's population. So I think we really do need to be thinking about the way that we are creating cities and make sure that we are embedding health into our decision-making process, to make sure that we are creating communities where people and the planet can flourish, rather than just short-term sort of decision-making to set up spaces for people without that broader impact on their health and well-being. But currently the legislative framework is maintaining these structures, and it's incredibly hard to try and flip this cycle without legislative change. And back in Victoria, I've used quite a number of international examples, but back in Victoria, we have seen quite a large growth in our sort of western suburbs. And as those suburbs and northern suburbs are cropping up, as housing developments are cropping up, we're seeing them crop up without access to key services, whether that means schools, whether that means GP access. And many of them actually don't even have nature strips or any trees in their suburbs either, which again is a concern when you think about the need for green space on physical and mental well-being, but also has impacts in terms of UV protection, influencing skin cancer rates, which is a particular concern in Australia, and also increases the likelihood of heat island effects, which is something that will continue to rise without radical change in terms of the climate crisis. For a few more local examples in Victoria, we know that when community groups and even local councils do try to change this narrative, try to push back on the legislative framework, we've seen multiple cases go to our Victorian Civil and Administrative Tribunal, or VCAT, to be overturned in favour of developers and in favour of unhealthy food industry organisations. Two quick examples include Tacoma, who were a group that set up community concern and mobilised community concern in regards to a new McDonald's opening up in their community. They managed to get 1,170 written objections into the council, and the council ultimately backed community. But despite these concerns, despite council backing them, McDonald's took the group to court, to VCAT, and were able to be successful in their pursuit, and McDonald's opened in Tacoma 3 years later and has been in Tacoma for nearly a decade now. More recently, we've also seen the Black Rock case, which saw retail giant Endeavour Group try to set up a new Dan Murphy's in the area. The Black Rock residents were concerned and voiced those concerns for over a year. More than 500 residents wrote to council. council again backed community and tried to stop the development. Their local member of parliament in the Victorian Parliament again backed community and tried to stop the development in any way that he could. But ultimately, again, the megastore was successful, and there is now this great big alcohol store in the community. And again, that was a case that went to VCAT, and the developers in organisation was successful. Not to be solely focusing on the bad part of this, but there are some exciting international examples of change happening overseas. These changes are tending to happen in areas like the United Kingdom and the United States, where local councils do have a lot more power. But there's still really interesting examples, and I've put the links to our report on this, which explored 10 different international examples, which is really exciting. But to just highlight a few of them, planning initiatives that look to improve food environments generally have two objectives. The first to be either to create restrictions for food retailers who sell predominantly unhealthy food options, and the second is to create incentives to operate, to increase operations of retailers who sell primarily healthy and nutritious foods. And the way that they tend to go about this is either through exclusion zoning to restrict hot food takeaway retailers, or restricting drive-through services, as well as restricting outdoor food advertising. One particular example includes the no-fry zone in Wicklow Island, which specifically implemented an exclusion on the construction and operation of new fast food and takeaway retailers within 400 metres of schools and playgrounds. So really having that focus on young people as well in their health and wellbeing. I'm conscious of time, so I would encourage everyone to go and have a look at that report. Happy to share that, and there's many more exciting examples. Just to flick through a couple of others, we have seen a road moratorium in Wales, which is really exciting because, again, it's about that pivot in terms of the way we're designing cities, away from roads and expanding highways to refocusing on public transport and actually reinvesting in community good. In Victoria, we have seen municipal public health and wellbeing plans become a key requirement of local councils, which just doesn't have an impact directly on planning, but it is elevating that conversation of health within a community level. And we did have a very exciting outcome where the Keep Mansfield Healthy and Mansfield Matters group did manage to stop a McDonald's development and the expansion of some electronic gaming machines in their local pub. But unfortunately, during that case, VCAT did actually rule that health evidence would not be allowed in that discussion or any future cases. So that was a real blow for us. This is more or less my last slide. Currently 50% of Australians live with chronic disease, and at almost every point throughout our day, things make it harder for us to be healthy and easier for us to increase our disease risk. And that is why we need to be thinking about these things, including planning laws and making sure that from the very start of our day, from the very start of our stepping foot in a different community space, we are creating a healthier and more equitable Victoria and Australia and global community. And so this is what we are aiming to see in Victoria. And in particular, this is how we're going to go about it in terms of commissioning more research, commissioning some particularly poignant case studies. At the moment, we're trying to get a parliamentary inquiry up and running into the Planning Act and how it intersects with health to try and get that impetus for change. And ultimately, we want to work with all of you across Victoria, across Australia, to try and build that support to have community and legislative change. Thank you.
Thank you so much, Steph. Wow, some really fantastic ideas in there. Thank you so much. We have got a lot of discussion and questions in the chat. Please keep that stuff coming along. And thank you again, Steph. My great delight now to introduce Min Seto to join us. Min's from the Australian Social Value Bank, or I always get the acronym wrong, that's why I'm looking at my notes, ASVB. Over to you, Min. Looking forward to hearing your sharings.
Thanks so much, Michelle. I'll just make sure that I can get my screen working before I kick off and share that. Have we got that screen?
Yes.
Can everyone see that?
Beautiful.
All systems are go. Thank you. That's what we want. So firstly, I'd like to start by acknowledging the traditional custodians of these lands that we're all dialing in from. I'm joining you from Anouin country. And I'd like to pay my respects to elders past, present and emerging. I'd like to say a big thank you to Nina for putting together this conversation, and also to Sarah, who has been helping out as well, and Michelle. And a big thank you to Steph. Lots of really interesting points there. And I have to say, we have started working with some developers and architects and in the construction sort of industry, and they're starting to look at the value of making sure that green space is included in design, and that there are different materials used to try and reduce the impacts of noise and all these other things from that wellbeing perspective. So I really look forward to the conversation after the presentations. But as Michelle said, my name's Seto. I'm the Executive Officer of an organisation, a non-for-profit called Alliance Social Enterprises, and we are responsible for the Australian Social Value Bank. And today I'm going to talk to you about distinguishing health and wellbeing and implications for government policy and decision making. So this may be a little bit controversial, I guess. It's great to hear like VicHealth, the government departments talking about wellbeing and wellbeing economies. I think this is a great step forward. And I guess I should kind of preface this with that I come from an impact measurement kind of perspective, but I'm sure that will be revealed as we move along. So when we think about the terms health and well-being, I mean, they're often used interchangeably, which is totally understandable given how closely related they are. But when it comes to government policy, I believe it's crucial to clearly distinguish between these two concepts, as there are both risks and missed opportunities when we consider them as one. So, I mean, health is technically defined as the state of being free from illness or injury, whereas when it comes to well-being, there's no consensus yet around a single definition. So this is from the World Health Organization, and it states that well-being is a positive state experienced by individuals and societies. Similar to health, it's a resource for daily life and is determined by social, economic, and environmental conditions. Well-being encompasses quality of life and the ability of people and societies to contribute to the world with a sense of meaning and purpose. So there's quite a few points in that kind of blurb that I think are really important. And it kind of speaks to the broader concept, but it's obviously a very long definition, so not very usable. But if we consider the many wellbeing frameworks that are popping up around the world, we can clearly see that health features as a domain in all frameworks, including this one from Germany, New Zealand, which lots of people would be familiar with, the OECD framework, and of course, Scotland and Wales, and any others that you actually care to look at. So this is due to the strong correlation between health and well-being. And common sense would suggest that it's difficult to have a high level of well-being if you're in poor health. But generally speaking, we think of health as only one of many dimensions that affect well-being, and that well-being is a broader concept than health alone. These wellbeing frameworks highlight that multiple domains contribute to wellbeing. So while health is a necessary condition for wellbeing, it's not a sufficient condition alone for wellbeing. Now, from a policy perspective, I believe there's a real risk in viewing wellbeing narrowly within the context of health. The South Australian Wellbeing Framework, which you can see here, is an example of where this has been done. We can see that this framework has been developed through a health lens, which is extended to include the social determinants of health, which they've titled the social determinants of wellbeing. While the framework contains many of the measurement areas included in other frameworks, its design prioritises health outcomes. The main risk with this approach is that the responsibility for making progress against this framework seems to sit within the health portfolio, or in the case of South Australia, they also have a department called Wellbeing SA, which does kind of prompt the question, what's the delineation between their health department and their Wellbeing SA department, if, as their framework implies, health and wellbeing are the same thing? But the point is, other areas of government, such as Department of Infrastructure and Transport, Environment Protection Authority, Department of Housing, et cetera, likely feel no responsibility to make progress against the indicators being measured by the framework, as it's seen as a health-specific initiative. So the intergovernmental silos remain. Whereas if we take a broader view of the concept of wellbeing as being greater than health alone, and we sit a wellbeing framework across whole of government, then all aspects of government have a shared goal of working towards improving the wellbeing of their constituents. It necessitates collaboration between departments and the breaking down of intergovernmental silos. And this is really one of the strengths of the implementation of wellbeing frameworks in government, and why it's best placed with either Department of Prime Minister and Cabinet or Treasury. When we consider wellbeing as a broader concept that sits across all of government, it also provides the opportunity to be used as a standard indicator against which all government activity should be considered. So if we look at the process of social impact measurement, the first important point to understand is that the term social impact does not refer to the type of impact as being social, but the impacts to all of society, aggregated. And this is one of the reasons why we often use the term social value measurement. Now, in this model, I've condensed the typical program logic into the first two steps, okay? So we're assuming that there are inputs that go to create a program, activity, initiative, however you want to refer to it as policy. We're assuming that there are inputs, and that those inputs then create outputs. That would be in a normal program logic, which then lead to the outcomes. Okay, so we've condensed those 4 steps into the first 2 steps. Now, those outcomes that are created can be both positive and negative. Hopefully, when we're designing programs, there's going to be more positive outcomes. And those positive outcomes can either improve people's well-being, the environment, or create positive economic outcomes. All 3 of these areas create value to society. But the area we're interested in today is the improvement in well-being, which becomes the critical social measure for all activities, because well-being creates value to society. It provides a common metric that can help policymakers compare the effect of different policies. And this is partly why there's momentum around the world to move away from GDP as a measure of societal progress, and instead start measuring the improvement in people's well-being. The CDC states well-being is associated with numerous health, job, family, and economically related benefits. For example, higher levels of well-being are associated with decreased risk of disease, illness, and injury, better immune functioning, speedier recovery, and increased longevity. Individuals with high levels of well-being are more productive at work and more likely to contribute to their communities. So we can see that higher levels of well-being will also affect economic outcomes, from a reduction in health service costs, increased productivity, and further flow-on effects to families and communities, such as better parenting, increased volunteering, increased community connectedness, reduced social isolation, etc., etc., etc. And all of these have a positive flow-on effect on well-being, which again can impact long-term health costs. One of the biggest challenges for government is trying to allocate its finite budget across a range of equally important competing demands. If we think of the example of health, imagine how hard this would be when trying to decide which health programs are more important than others. Do you fund support programs for childhood leukemia or Alzheimer's? And this is really the main role of health economics. It provides a framework for thinking about how society should allocate its limited health resources to meet people's demand, need for healthcare services, health promotion, and prevention. Over the years, a range of measurement approaches have been developed, such as QALYs, which are quality adjusted life years, and DALYs, which are disability adjusted life years. And these help assess the benefits of different health interventions. But what we're attempting to do is bring about a standard measurement approach for impacts on wellbeing so that they can be included in decision making. Now, we often get a lot of pushback around this from people saying, it's reductionist to try and quantify social outcomes. And having worked in community services delivery for the majority of my career, I totally understand this perspective. However, if we think about how funding is currently allocated across human services, do you really want to leave it to the sectors with the greatest lobbying power? And even more compelling is when major decisions are made that fail to include the social and environmental impacts at all. If we take the example of a proposal for a new mine, a business case will be put forward using cost-benefit analysis. However, traditionally, they would only quantify the economic costs and benefits, generally failing to quantify any impacts on people or the environment. If you are lucky, there might be a note in an appendix at the end stating that it may have some flow-on effects to the environment or local community, but not always. So whilst they would quantify the number of local jobs created, for example, they would fail to quantify the health impacts on the local community from reduced air and water quality, loss of biodiversity, impacts on local housing affordability, etc., etc. Clearly, this has resulted in some very, very bad decisions being made. But thankfully, this is starting to change, at least in terms of the environmental aspect. So how do we monetize wellbeing so that it can be included in decision-making? We use a methodology called Wellbeing Valuation. And when I say we, I mean our partners in the UK, Symmetrica Jacobs, who are world leaders in social value, wellbeing research, and impact evaluation. We start by looking for existing data sets that contain a range of demographic data, information about what we're trying to value, income data, and the single subjective wellbeing measure. Overall, how satisfied are you with your life? Now, this single measure of subjective wellbeing has been validated as performing very similarly compared to multiple item measures of wellbeing and is therefore regularly included in surveys around the world. The main survey that we currently focus on is the HILDA survey, the Household Income and Labour Dynamics in Australia survey. But it's important to understand that there are many other surveys in Australia and around the world that meet the requirements necessary for wellbeing valuation. It's worth mentioning that because there are so many existing data sets that can be used, and so it makes it a very cost-effective approach. And additional questions can also be added to existing survey data collection for specific outcomes. So wellbeing valuation is considered a quasi-experimental approach. Basically, we're setting up a control group and a treatment group within the data, and they're statistically identical apart from the outcome that we're wanting to value. We then look at the average difference in subjective wellbeing between these two groups, and this allows us to identify the average improvement in wellbeing created by the outcome in question. We then calculate the average amount of income it takes to increase subjective wellbeing by that same amount, and that becomes the monetary value. Now, this is not the only methodology used to monetize the value of social outcomes, or non-market valuation methods as they're referred to in government guidance. They include revealed preference, stated preference, and benefit transfers. And without going into detail on these other approaches, some of the main advantages of wellbeing valuation is that these values are based on the actual experiences of Australians. So unlike with stated preference surveys, people are not asked to imagine what they would be willing to pay for a particular outcome or how much they would be willing to accept to forego a negative outcome. But probably the most useful difference is that because the methodology is consistent across the data set, wellbeing valuation allows you to compare different outcomes across different policy areas in a way not previously possible. This is a significant development in the assessment of social policies and programs. It means that we can compare health outcomes to housing outcomes, as well as more abstract outcomes like the value of feeling part of your local community or having hope for the future, for example. This approach makes it possible to value anything in relation to the impact it has on someone's well-being. Now, we could have just as easily used the average improvement in well-being as the measure, right? So we could look at each outcome and see what's that improvement in well-being without going that step further to convert the improvement to dollars. But the benefits of translating these wellbeing improvements into dollars is that people have an instant understanding of the amount of value a particular outcome creates. It also allows these improvements in wellbeing to be considered within economic evaluations, allowing wellbeing to be considered within decision-making. We can start to answer questions like, what's the impact on people's well-being if another shopping centre is developed in their neighbourhood compared to that same site being made into a park with a playground, for example? Or is it better for someone's well-being to volunteer once a week or to join a social group? Whilst I can't answer the first question for you yet, because we haven't done the research, I can tell you that the improvement to your well-being from volunteering once a week is about $640 more than that of you joining a social group. But that meeting your friends regularly, say once a week, is more than double the well-being improvement of volunteering once a week. So you can see how this starts to put things in perspective and can change how we think about different interventions or programs and activities. So in conclusion, distinguishing health and wellbeing in government policy allows for a more comprehensive and inclusive approach to decision-making. By recognising the broader dimensions of wellbeing and incorporating wellbeing valuation methodologies, we can better prioritise resources, promote collaboration between departments, and ultimately improve the lives of Australians. So let's embrace this distinction and harness the power of wellbeing in shaping a brighter future for all. Thanks so much.
Thank you so much, Min. Yes, you're right. There's some really challenging notions in there, isn't there? And, you know, I think most people who know me know I'm sort of a deeply interested in the well-being of all living creatures. So some would call me a greenie, others would call me a very practical human trying to build a stable society. And this monetization, the words we use in the West, you know, part of us want to challenge that, and then part of us want to say it's a step towards a different paradigm, perhaps. It's some very interesting issues in there. And I like your point that, you know, if we don't play a little bit in this space, how do we push back at the system that is like very powerful and deeply embedded in the monetization of everything? So some really tricky issues to explore. And thank you so much, Min. Lovely and clear articulation of those things. Now I'm really delighted. Last but not least, Carla Clarence is going to join us from the very fabulous folks. And again, I'm looking at my notes. There's a lot of long names for things that I'm a bit sick this week and I can't remember anything. Carla is from the Australian Centre for Social Innovation, known lovingly by some of us as the Taxi or Taxi. Carla, we'd love to hear from you and to share some of your insights into health and wellbeing and all of those muddly spaces in between.
Oh, thank you very, very much, Michelle. And I'm going to borrow that term, if you don't mind, lovingly known as Taxi.
Feel free.
Lovely. So thank you. I wish to acknowledge that I am joining this fantastic conversation today from the beautiful Gadigal country, right in the heart of Redfern here in particular, and wish to pay my respects to all Aboriginal and Torres Strait Islander elders and peoples of all time. Acknowledging that all of the lands that we are on always was and always will be Aboriginal lands. And I'd really like to say big thanks, Michelle, for the invitation to be here and for the team at NINA. And huge gratitude to you both, Stephanie and Min. I've got reams of notes here, some fantastic learnings, which just really shows the power of this kind of forum of coming together and sharing and being in this together. from our own sort of unique takes. So yes, I'm Carla Clarence, and I'm a principal at Taxi, I find myself leading the action area that we are deeply committed to, which we have named the future of mental health. And I work very closely with many folks across the Taxi network, including my good friend who's on this call, Ashwini Alluri. I guess a little bit about me is fundamentally I come to this work having worked on the front line as a frontline worker for most of my working life. And I got to work with people that were experiencing a whole myriad of challenges, and within those challenges were also needing to work within and across really punitive systems that, were not doing their well-being or wellness any favours. And it's those people that I epically thank, and they were my greatest teachers. And I bring in their voices and their big learnings for me into the work that we now do at Taxi. So today, I would like to talk to you about a concept, an initiative. Not quite sure what the end result of this thing will be, but we're calling it the Future Wellness Accelerator at this stage. So what I'll do first is I'll show you a short little movie that we made about it, and then I'll bring you back after that little movie and share a little bit more about the detail and the nuance of what we've been doing since this idea came to fruition. So just bear with me one moment and I will share screen. And here we go.
We wish to acknowledge the traditional custodians of the lands on which this project took place. We recognise that wellness for First Nations people was violently interrupted by colonisation, and that the harms of colonisation are real and ongoing. And we also recognise how much there is to learn about wellness from First Nations ways of being and valuing. All of us know someone who has or will have a mental illness. Almost half of Australian adults will meet the diagnostic criteria for a mental illness at some point in their lives, and that number's growing. Recent investments in mental health services have been celebrated. They will make us better able to meet the demands for services, but that demand will grow indefinitely unless we address the root causes of growing levels of mental distress. There are some real gaps in our mental health responses that won't, and perhaps can't, be filled by government and services. In June and July 2022, we brought together a diverse group of people for a future wellbeing conversation series. We explored what has changed in the last 200 years to lead to these increased levels of mental distress, and what to do about it. The group included Aboriginal leaders, young South Sudanese Australian leaders, foundations, academics, executives, a general practitioner, a mental health nurse, and mental health commissioners. We agreed on 3 changes that seemed significant and true across peoples and cultures. Connectedness has changed. Our relationships to the things that once gave meaning to our life have changed. Country, culture, language, religion, place, work. Children today have more exposure to options for who to be, but weaker ties to institutions, places, and reference points to help them decide between those options. Who am I? Who are we? Are existential questions that haunt people across cultural backgrounds. This made us wonder how we should be navigating meaning and belonging in the 21st century. What are the new infrastructures and cultures that will keep us strong? Understanding has changed. Our common understanding of the depths and complexities of the human experience, the light, the dark, the shade, has changed. We once acknowledged suffering as a universal truth. We talked of spirit and constitution. While Indigenous people and many non-Western cultures still do, these concepts seem to be slipping out of common usage. We wondered about the cultural concepts that need to be reinvented for the 21st century and how to bring them alive through our institutions and societies. Responsibilities have changed. We discussed how many intuitive human functions, such as caring and compassion for those around you, have now to a large extent been outsourced to institutions, including mental health services. Yet those institutions struggle to respond effectively. We wondered how to rebuild responsibilities for the wellness of self and others, and how to take responsibility for creating the futures we want to live in. Discussions in the group focused on how mental health is determined by a complex interplay of individual, social and structural stresses and vulnerabilities that are bigger than any one entity to change. We agreed that we can only stem the growth of mental distress by working beyond the current boundaries of the service system. In homes, schools, online, in communities, clubs, societies, on culture and through media. Responses in these spaces do already exist. Here are a few of them. Don Ritchie has prevented 160 people suiciding over 45 years, across the road from his house, by talking to them. Conversations with grandmothers on friendship benches in Zimbabwe are providing a better response to depression than the alternatives. The Compassion Project is spreading compassion education throughout schools in the USA. In Adelaide, community member Sonny Jane hosts the Drop-In Care Space for individuals who identify as queer, gender diverse, neurodivergent, autistic, disabled, or living with mental health struggles. In the UK, the Mental Health Foundation is advocating for public policymakers to recognise their role in helping to create the conditions for fostering kindness. And the City of Portland is funding community activities that help Portlanders grieve and heal, a creative response to the emotional toll of the pandemic, recession, racial justice reckoning, and a number of climate change-fuelled extreme weather events. But these kinds of responses are easily dismissed as fringe, fluffy, or unreplicable. Yet, whilst they may lack mainstream legitimacy, in-community responses are the only thing that can de-escalate Australia's mental health crisis. The only way to rebuild connections, identity, and responsibility. The only smart response to a $220 billion challenge. The participants, many veterans of conversations about mental health reform, remarked how the conversation series provided a space unlike any other, a space to explore what's fundamental to our wellness. At the same time, they expressed an urgency for action. The substance of the ideas we explored in these conversations, like connection, kindness and compassion, are indeed delicate, strengthening the case that they need to be properly protected and nurtured. The Future Wellness Accelerator is an idea for a new infrastructure developed through those conversations. It would help us get to the future faster by bringing together people and organisations working on in-community wellness responses to help them advance the impact and influence of their work. Participants would include people innovating at the margins and people with influence in big systems, people trying to develop new things, and people with successful responses who are looking to grow their impact. Businesses and not-for-profits, people working locally and nationally. Together, supported by each other and the Accelerator team, they would build a shared vision of the future, widen their sense of what's possible, shape their own actions to reach that future, allocate funding to accelerate progress towards that vision, and promote the ideas they develop to funders, commissioners, policymakers and the public. And because what shapes wellness is everywhere, it wouldn't just do this once or in one area, but across many portfolios over time. One portfolio might be focused on improving wellness for young people online, another on parents, another on a specific state, region, or even a town. A portfolio could be focused on specific responses, for example, alternatives to emergency departments, or wellness in the workplace, or even in a specific industry. Mirroring a key feature of the conversation series, participants and decision makers would represent the real diversity of Australia, including First Nations and lived expertise. A future wellness accelerator of this kind would be a vital new public infrastructure that would address a startling gap in our national strategy, to rebuild the factors within communities and individuals that keep us well and prevent avoidable mental distress.
Well, thank you for paying attention to our little movie there about the Future Wellness Accelerator. And I guess this has really come out of a place where many of us are desperately worried about a continuing decline in our well-being and the increasing experiences of crisis and distress for many. Well-being is being compromised for the majority, and those entrenched in the realities of marginalisation are further at risk than ever before. And, you know, through this process and through much of the work we do at Taxi, you know, many of us want to do something about this stuff, but are unsure of what to do. And this, of course, has potential dire consequences for our children and future generations. So some of the research that we have explored tells us a number of things. It tells us that there are still many things we don't know or that are unexplored when it comes to mental health responses that work. The research also tells us that there is actually a strong case for in-community responses. It also tells us that mental health disorders are the largest source of health-related economic burden worldwide. Some of the research also tells us that multiple structural stresses, such as economic downturns, social polarisation, and public health emergencies, actually have the potential to slow worldwide progress to improved well-being. The research also tells us that half of all adult mental health challenges in Australia have their origins in childhood. And post-COVID, prolonged languishing is a potential and somewhat invisible 10-year crisis looming, where people experiencing long-term and significant languishing are actually 8 times more likely to be diagnosed with a mental health condition in 10 years' time in the future. And we also checked in with what some literature was saying about these 3 big things that the little movie suggests around connection and understanding and responsibility in the context of wellness. And this scan really validated the paramount importance of connection and its direct correlation with poor health outcomes and loneliness. Younger generations are asking about and stepping into responsibility, being strongly aware of social issues, expressing significantly more interest in becoming healthier, more environmentally conscious, and actually being more helpful to others. I'm sure we can all think of examples of where we've seen young people do this. An understanding of one's own mental health and that of others is complex and can be impacted by societal and self-stigmas, but can be supported through recovery-orientated and strength-based approaches. So we're at the development stage of the Future Wellness Accelerator and have generously secured some initial investment from philanthropists to support the shaping of this. And most recently, we've been pulling together all that we've learned through the conversation series that the video shares with you, diverse research scans, and also conversations with others trying to pull off creating big systemic change ambitions and new infrastructures like the Future Wellness Accelerator. And this has really supported us to do some initial thinking about what could be a conceptual model design of this Future Wellness Accelerator. And that's included thinking about initial thoughts of how that portfolio model may operate, where there's lots of areas of focus housed in a broader accelerator container that's really enabling us to actually hold this bigger challenge and not just seek to focus in on one component. And this development stage has also given us some insight into the role of funders, the diverse people stewarding the work and the roles that they might play. And also it's really given us some initial hunches on, well, what portfolios might we start with? What should be a focus moving forward, at least from the outset? And we think there is also a real potential in adopting and adapting the best of research and development approaches from science and industry into the social space, including things like the Future Wellness Accelerator. You know, R&D is a proven approach to creating long-term value. And social R&D within and around the Future Wellness Accelerator would support us to identify and focus on specific innovations, to spot new opportunities, and to be certain about what actually works. And then with great care and sustainability measures, grow and scale the impact of innovations across households, communities, schools, workplaces, and beyond. So our work at Taxi continues to time and time again tell us that solutions are in the opportunities where social systems and citizens can connect in ways that promote innovation, enterprise, and concrete action. But we can't seem to get over the policy, responsibility, and resource flow hurdles to do this. So the accelerator is seeking to activate a bridge across and within the social systems that have a stake in wellness, and an opportunity for them to endorse and support, partner with, and advocate for in-community responses. So this is all about bringing systems and citizens closer together and not further apart.
We're just about out of time, Carla. Are we?
Thank you. I'm just finishing up. Thank you, Michelle.
Thanks.
And whilst being in this development phase of the accelerator, we're really considering, what does it take to re-energise existing systems and formal services, and not really see them as these impenetrable structures out there beyond our reach to change, but rather see them for what they truly are, systems of people, and people that care about being of service to us collectively, having a firm grip on our wellness. So it's a huge ambition, and this is very early days, but with the right people, the right resources, and a future-orientated courage, and perhaps a renewed sense of legacy building, the Future Wellness Accelerator and other social R&D infrastructures could be the North Stars that we seek to make significant shifts. And it's really important, just in finishing here, that we really believe that central to the success of the Future Accelerator will be the co-investment and the co-leadership of multiple partners in its further design and future operations. And we look forward to seeing that come to fruition. So thank you for your hearts, minds, and ears. Thanks, Michelle.
Thank you. Thank you, Carla. Wow, this is so much food for thought from these three excellent presentations. So folks know, I've been collecting the questions, and I'm going to run through some of them in order. Some are being themed and grouped just to make sure we have enough time. We've basically got nearly 20 minutes for Q&A, but more like 17 minutes if we do a proper wrap up. So please be patient. And if anyone would like to speak and ask a question, please feel free to press the little hand button. But as always, in terms of distributive justice, I'm going to try to work through questions that have already come through, but please do pop your hand up if you want to chat, or keep putting questions in if you wish. So I, not so much I'm going to work back to Steph. I'm going to have a couple of questions for Carla, and then I've got a couple for Min, Steph, and then all of you. So I'm kind of working a little bit backwards, but not. Firstly, Carla, thank you for that. And that video was quite remarkable, particularly at the beginning when it was talking about those conversations. And a number of folks asked for the link, and I think one of your colleagues has popped it into the chat. So if you've missed it, I will put it in again at the end. Sometimes people get confused with the chat. We will put that link back in, as well as links to some of the other projects that have been mentioned in there. So thank you so much for that, Carla. And in terms of next steps for the Future Accelerator, I'm asking a question with my Nina hat on. Will there be further conversations in different communities? What are the next couple of steps? Obviously, funding and all of that is a big issue, but in terms of the practical aspects, what's next for that accelerator?
Thank you, Michelle. And just acknowledging, thank you for the other comments and questions. Absolutely. I mean, the concept has included some really diverse people through the conversation series, and philanthropists and us predominantly from the outset. So really opening up that co-ownership is really integral, we believe anyway, to the success. And it certainly has been backed up by the learnings we've been doing about other initiatives of trying to be of a similar stead. So I think our next steps really are focused on partnerships. It really is about how do we best open up as broadly as possible to organisations, to communities, and to the public, to citizens, to actually interact and shape whatever this future wellness accelerator is to be. So I think from an initial step, we're really keen to chat with folks who feel a resonance with this and feel like they perhaps would like to partner, because part of what we would really like to do is then co-design, together co-plan what that partnership model might look like. So we're trying not to get too ahead of ourselves in designing a product or an end result, but more so now we need to bring on people, and we've got some ideas to test. So I guess we really welcome people to reach out, to contact us, to have conversations, and we will actively be doing the same.
Thank you. I can say that Nina will definitely be reaching out to try to partner or be part of things, because there's a number of communities engaging around local and regional hubs activities that I think it would be really lovely. But thank you very much, Carla. There are a couple of questions about definitions between wellness and wellbeing. I think I might leave them to the end so that everyone can comment. I might go now to a question specifically for Min from Ash. Min, Ash is wondering if ASVB's perspectives and experiences, the measurement and evaluation around well-being and health in relation to a conceptual frame proposed by Sydney University's Brand and Mind Centre to estimate the mental wealth of nations. So I'm not sure if I read that correctly. Wondering about your perspectives of that Sydney University's Brand and Mind Centre. Are you aware of that, Min?
Sorry, Michelle, just to kind of apologize.
Yeah, sorry, Ash. I think I might have missed that.
So yeah, I think I typed terribly with all spelling mistakes in there. But the Sydney University's Brain and Mind Centre have just kind of launched a conceptual take on what they call estimating the mental wealth of nations, and it's a conceptual piece. I think they're kind of threading on all the same things that we're talking about here, but they've kind of framed it in the concept of mental and wealth, which I think is interesting, but they're trying to target some messaging to, I think, the private sector a little bit. I'm just wondering, Min, if you've seen any sort of overlaps, critiques, gaps, or kind of synergies, with your work, with the rigor that you think about your work and so on.
Thanks, Ash.
Hi, Ash. Thanks for the question. It's a really short answer. I'm not familiar with the piece of work, so I can't really give an opinion, but I'm very keen to have a look at what they're doing. I mean, I think we're kind of at that point where there's lots of different people trying to get their heads around this issue and how we can start to move it forward. So yeah, always keen to see what others are doing.
Thank you. Thanks for that input, Ash. Min, another question. Sometimes folks put them in the chat. Sometimes they send them to me privately, whether erroneously or out of shyness. It's all good. Someone has asked, can you give an example about how your work, sort of trying to show people how we measure well-being differently, has changed something? I think they're trying to grapple with, what does it mean to do this work? What does it look like in terms of showing people how to measure it? What does it really mean? I hope that makes sense.
Yeah, absolutely. So there's kind of two aspects, I guess. The first is it actually can really shift people's thinking, like how they approach things. So for example, I've just started working with an architecture firm, and obviously something that is so outside of my, expertise, but, they were really interested in trying to understand the value of some of the work they were doing. And so going through that process of trying to link, okay, so there are specific design features that you have put into your designs thinking that they improve people's well-being. So for an example, they had created different areas within the building design, and this was for social and affordable housing, I should say, where they've had larger hallways and courtyards and rooftop gardens, and they talk about this, they have this big lift lobby, and these design features have been put in to really encourage social interaction, right? But because we know that obviously social isolation is really bad for people, and their well-being. And so, there's lots of research about the importance of social connection and that kind of thing. But in the past, they'd kind of done these things, but they had no idea, well, did those design features actually promote that, you know? And so actually working with them to collect data and actually ask residents of the development, which is not something that this architecture firm had ever done. And lots of architect firms, you know, are sort of in the early part of the process and don't ever kind of communicate with residents at the end. They actually went and they, you know, collected data to see. And the results were actually really amazing in terms of how many people said that, you know, they regularly were connecting with their neighbours. And so then being able to value that, it kind of joined the dots for this company to kind of go, okay, so, you know, this is what we can do as part of our design, and these are the end results, you know. And so while those things may have cost, those features may have cost more to actually build, you know, we could see that there were improvements to people's well-being. And so, you know, that helped them to justify when they go back and they're trying to put forward these ideas, you know, that, that there's some evidence for them to speak to. So it kind of does, that thinking kind of changes, but also just in terms of resource allocation. You know, we work with a lot of community housing providers, and when they can do sort of estimations of different programs, it can really help them to decide, okay, well, we're going to spend more in this tenancy group, because we know that when they feel more involved in decision making, you know, that creates value for their well-being and connectedness and all these sorts of things. So it helps them to kind of make those internal decisions as organisations, and we hope that over time those bigger decisions being made by government will hopefully start to factor those in and change some of the outcomes.
Thank you. Excellent example. And yeah, look, the work we do in NINA, we're constantly struggling with how we shift from this current paradigm of, and I'll come to Eva's excellent question shortly about how the tsunami of neoliberalism in the 80s and 90s has now meant that so many people can't see beyond the monetization of stuff. And it's, how do you shift these mindsets? And whilst, as I said before, some folks critique working in the framework to show them some different way of thinking about the financial or other value, for some people, it's the only way to take those steps back into a place that, like I'm lucky enough to work with Indigenous elder Mary Graham and talking about the relationist ethos and understanding the purpose of a society and culture. None of that connects to economics or money as a modern form of economics anyway. So thank you for doing this hard work, Min. You must cop a bit of flack here and there, trying to bridge these concepts, doing good deeds in the language of the master, you know, which sometimes we want to break down. Anyway, that's a very muddled metaphor and quote. I'm good at that. Thank you so much, Min. A couple of really great questions for Steph now, who's been sitting very patiently in her room. Thank you, Steph. There were quite a lot of questions about the work that VicHealth is doing. So I've grouped some of them together. And I think the big one that popped up, particularly because you were the first speaker, Steph, and I'll invite any of our speakers to comment on, is what the heck happened to the wellbeing budget that Jim Chalmers talked about? And I mentioned in our chat that in the budget rundown that Nina hosted with Matt Grudnoff from the Australia Institute, I put this question to him too. 1 minute last year, wellbeing budget was a big thing. And then this budget, there was no discourse about it at all. But I see from your comments, and I'm aware in the fringes of my brain, this measuring what matters framework. So Steph, can we come to you first, and then I'll let everyone comment on what is the Australian government up to? What is this measuring what matters framework thing? And how's it all looking?
Yeah, great question. I think, you know, first of all, Jim Chalmers has definitely spoken about wellbeing budgets for a number of years now, and the previous federal government, you know, would take his comments and talk about yoga and just really make a lot of disparaging remarks about the concept. So I do think that we should be have a level of excitement about the new government, and that Jim Chalmers has continued to have some level of discourse around wanting to deliver a wellbeing budget. We had hoped that this year would be Australia's first wellbeing budget, but they did embark on this measuring what matters consultation. And VicHealth did put in a submission to the first round of the measuring what matters consultation. And that was, again, very focused on indicators, on budgetary indicators, and often comparing them to the OECD kind of other indicators of progress. And that was a system that we think was, you know, a good starting point for the conversation, but not good enough for what we really want to see. And one of the big pieces of feedback that both VicHealth had and a number of other organisations in this space that have been working in the wellbeing space had for that consultation was to actually have consultation with community, to get into the grassroots and actually find out what, you know, quote unquote, everyday Australians, what matters to them. And so what did happen as a result of that first consultation was a second consultation phase opened that was about organisations having those consultations with community and then feeding that back through the second measuring what matters consultation process. So it wasn't 100% community consultation, but we did kind of take that as a win that the government was listening and was trying to figure out a way to actually try and do this properly. So yes, it's been sad that it's been delayed. We are hoping to have the kind of results of that second phase and a measuring what matters statement released in the second half of this year. This is going to be a long-term process, but we think there's fertile land there now, to excuse the metaphor, to have some change happen. Again, from a VicHealth perspective, we want to make sure that this change, one, happens, but two, extends beyond the budget process. So that's always part of our narrative as well. But yes, sad to have it delayed, but good to hear government is listening.
Actually, great. Claire B often has great suggestions, but she's put, they could ask wellbeing questions in the census. Grand idea. Min, Carla, please, if you've got any comments on the government's, I mean, everyone's interested in what the Australian government's up to with this. And there was a bit of disappointment about the budget, but as Steph said, you know, we should be grateful after the crew that were in the 15 years previous that anyone's even taking any notion beyond jobs and growth as of a topic of interest. Min, what are your thoughts?
I mean, I think Steph did a great sort of wrap up of the process and what's happened. I think the second consultation, everybody was again really disappointed that this was kind of you know, not a real consultation. And I think they got a lot of feedback back saying that you know, that wasn't appropriate. But I think it's important to realise, you know, to do it properly, we obviously need to have a conversation with the Australian people. And the reason people are speculating that we're not doing that is because we don't want to muddy the waters around the referendum voice to Parliament. And so there is some people saying that potentially, you know, government is just floating kind of their ideas, but that once the referendum has happened, that potentially, you know, then the proper conversation will actually start. So that's all conjecture. I don't know if it's true, but we're kind of hoping that they will go through the process of doing genuine consultation with community.
And Carla, any thoughts on that before we move on?
Oh, look, I went to a post budget release and I heard Jim talk about the fact that it wasn't mentioned, and there was just a bit of a statement said that was very intentional, and that wanting to shine a light on the what matters, what matters consultations was actually a separate component to it. But I mean, I have to say, I do feel somewhat optimistic. I think even in some of parts of the second consultation, the taxi community participated in that, that there at least seems like there's some sentiment and some intention of doing things differently. The one last comment I'll have is just, I find it really interesting how we find out about these consultations. Often you have to dig around or be privy to that information that they are even on the radar. And I just think that's a challenge and just a point from me.
Look, as a civil society network born from and focused on ordinary folks having a yarn and building different systems, I agree with you. And we've always got our radar out a little bit for what's going on with the government. But when we were born, it was at a time when we knew we couldn't look to government for any of much of the good stuff. So this is definitely an invitation to all of you who get involved in those government policy discussions. Please feel free to come and tell the rest of us about some of it at any point in time. Hey, I've got a couple more questions for Steph and her work, but I'd actually like to jump to Eva's excellent comment. Good to see Eva joining us, a very, very, very renowned social analyst, Michelle needs lunch, and expert on challenging economic ideas. Eva writes, I'm old enough to remember the optimism of the 60s and 70s when we tried to create communities. We saw this fall away with the rise of neoliberal economics. How do we revive the goodwill until we move away from the GDP models? We need to expand the debates at the top away from economic growth and back to human needs. This needs some very serious, serious differences to policymakers' beliefs in the fact that we're not customers, we're citizens. And I think this feeds perfectly into what we were just talking about, but I'd love to hear your thoughts. Oh, hang on, Eva, let's let our speakers have a little moment to think, and then we'll come back.
Yeah, I mean, I just want to, a resounding endorsement of that kind of commentary. And I think I often really struggle with that kind of consumer and customer language that you often see, even in terms of, operationalizing a health service. It's about the consumer. And I think that's a really problematic frame when we're trying to talk about degrowth, other indicators of prospering society, and not having people consume so much, which is a huge problem in the Australian context. How we shift that, I mean, I think that it's a great question. I think there's got to, there's so many points of education, or maybe we need a few of the old consciousness raising groups back, which I mean I think is kind of what Nina is and is trying to do, but it's definitely a shift we need, and a refocus on people and planet as our primary things that we are looking to serve rather than economic growth.
Thank you, Steph. Min, Carla, opinions are welcome. You do not have to provide an evidence-based analysis or baked analysis for your commentary. What do you think? How do we do this? How do we keep shifting these bloody conversations towards the stuff that really matters?
Yeah, look, I mean, I think it's big because it's the whole structure that needs to change. It's our whole society. It's how we're raised. It's the whole shebang, and so obviously that's really hard, that's overwhelming for people. But I think if you look at what's happened as a result of the pandemic, I think if we don't make these conscious decisions to redesign and change, it's not going to be left up to us. The planet, society, when democracy breaks down, however that looks like, it's going to be crisis that is going to insist that changes, and it will be taking out of our hands. So, on one hand, I hope that we have enough passion and determination and all those things to do that redesigning and to kind of, reset the stage. Because I feel it will happen regardless otherwise, and it won't be pretty. There'll be fallout if we do it the hard way.
Carla, and then we'll come back to Eva, because I'd like her answer to that question. I think you know the answer to that question. Carla,
I very much would love to hear from Eva. I think it speaks to this sentiment and insight we kept hearing in the development of the Future Wellness Accelerator, of having outsourced things that fundamentally are part of our citizenhood, if we want to call it that, if that's even a term. And so I guess that's interesting to think about how that reclaiming of our roles and our responsibilities and our role in shaping our future. And again, trying to lean onto this optimistic stuff of what we're seeing the current state play out is, I guess, the concentration or commitment to more place-based collective impact kind of things, where that localized, more, collaborative, diverse coming together of people to make change and do change together. I'm hoping, especially now that it's got some federal budget attention, maybe that's going to be a way forward.
Thanks, Carla. Eva, what do you think we have to do?
I mean, one of the things I've been trying to do for a very long time is to sort of try, and I remember arguing with Nina in the first place that maybe using the term economics under the assumption that we could change economics was probably starting from the wrong way, because it meant that the economics still stayed as a dominant idea. I think we've got to put the social back on the agenda. It sort of disappeared entirely from that, and you can see that in the way that we do not acknowledge any of the unpaid work, which is one of the factors that you've brought out quite often in this discussion as being one of the things that creates communities. And I know it creates communities, and you can get some very passionate and appropriate things happening at the local level. But unless we really seriously get into the federal level and make sure that we are actually working at that level with the people in, I mean, there must be some members of parliament that actually understand this. I know there are a few. So that we don't just see it, because I had a bit of an encounter with Jim Chalmers a while ago trying to sort of talk about this. And yes, he's quite keen on local people getting involved in local things of that sort. But he's actually completely anti the fact that this is going to happen as part of the community at large. It's going to happen in disadvantaged communities like the one he actually represents, which is the, you know, the area on his own electorate. And that's fine. You know, we're going to get these under functioning areas functioning so that they can become like the rest of us. But it's not saying that, you know, that one of the things that is really important is creating a sense of the social and the relational and the trust. And what you have to look at the moment, one of the things I've spent a lot of time looking at, and it would be interesting to try and work it into your stuff, is how far people do trust government, because the trust in government has been falling all over the place, internationally and locally. And when you don't trust government, you tend to be pushed into self-interest or maybe local interest, but you don't actually get the sense that you can do anything at the national level, which is going to improve things. So I think a lot of the stuff that you're doing, which is very interesting, will get frustrated in the same way as community development did.
Yep.
Way back in the 70s and the 80s, and started disappearing because they were working at the local level, and they just got wiped out. You know, the whole idea of them just got wiped out of the community development. And I think a lot of what I was listening to today was a mirror of a lot of the issues that were being pushed up in the 1970s and 80s as an attempt to change things. I mean, I actually delivered the ABC Boyer lectures, if you want to find them, called A Truly Civil Society. I think they're still online. I think you can still find them, where I predicted if we did not get rid of this, that we would end up with a worse situation. And unfortunately, I was rather good at predicting, because we actually have a government which spends so much time on the economy that it actually, you know, regards the whole welfare system as a way of getting people into the workforce, rather than the recognition that a hell of a lot of the workforce stuff still depends on the arts and the various other things, which are areas which you don't get into to make money, but you get into to make good societies. And society as such has disappeared.
Thanks,
the more we turn us into customers,
yes,
the less likely
that's how the market works. They commodify everything.
They commodify everything, and they'll commodify, you know, what people want as well, if you're not careful, because that will just be seen as a sort of thing that if you had that at the local level, you wouldn't have to spend so much money on things like community services. I mean, I wrote an article for John Menadew's Pearls and Irritation things after the budget, pointing out that quite apart from the fact that they left all of this stuff out, they also left out privatization, because privatization is anti a lot of the stuff that we're doing. It means that you actually run community services for profit, not for...
Eva, I'm really sorry to interrupt. We're going to have to wrap it up. We're 5 minutes over. I could talk about this stuff for another hour, but I can see...
Well, can I just say as a final thing, I think it would be very interesting to have some discussions about how we take the ideas and how we pummel your representatives and tell them that they've got to sort of be trusted. And one of the ways of being trusted is to be seen as actually running those things which aren't suitable for markets. You know, like childcare and aged care. And a very good
we talked about this with the budget rundown with housing too. But look, we'll end that chat there. Thank you so much for sharing with us, Eva. I'm starting to get some ideas about some stuff we should have in NINA around. Well, can I just say, you can see the topic of our conference. We deliberately tried to be a bit controversial because what we're seeing is the growth of well-being economics or well-being economies is excellent. It's a great step forward, but many people are diluting it. They're taking it and just making it the usual, well, I call it greenwashing, but I guess that's people washing. And so what we want to do at this conference is get people to actually imagine life without hypercapitalism or even capitalism at all. Eva, I might get back in touch with you and some others who are working long before the rest of us, and we'll have sessions about what did life look like prior to this. And because remember the Tina, there is no alternative. Younger people today do not know what a world looks like where it's not everything is for sale. And I've already started a series of really looking at this market trading or commodification even further of nature. I think we should look at a similar discussion around this. Fascinating stuff. Steph, Carla, Min, everyone is interested in your work. If you have papers, materials, videos, anything you want to share, please send them through to us in the next few days. We'll actually put them on the same page as the recording for this event. There are a number of questions there I didn't get time to chat about with you. People asking about the distinction between wellness, well-being economies, why sometimes you can look things up and you end up finding a massage parlor instead of an economic analysis. You know, these are the terms and the phrases. But there's also so many good things to talk about. So look, I'm really, really so thankful to you for bringing the human health aspect into these conversations. It's an area that Nina is really desperate to connect with more practitioners. So please, if you've ever got new updates, research, reports you want to share, give us a hoy and we'll promote you as widely as we can. But on that note, can I thank you all for your awesomeness to stick with us for an hour and a half plus 7 minutes over. And thank you so much to our speakers and everyone who's asked a question and had a yarn. And I really do want to plug our conference. It's going to be glorious. It's going to be in Canberra. It's an in-person gathering. I know it's old-fashioned. If you've got to ride a donkey and you're worried about carbon miles, just do it. We really want to get humans together again, because it's only by talking and having those chemical interactions of your brain going, oh, I'm not alone, that we can in fact actually do good deeds. So on that excited and slightly hungry note, I say thank you. Let you all have the final thank you and good night kind of thing, and then I'll shut us down. Thank you so much. Love your work. Have a groovy day. Thanks, everyone.